The major strike by junior doctors is also putting the British government under quite a lot of pressure. And the doctors' demand is 35% more wages. But is that appropriate or absurd? So the junior doctors are on strike in Great Britain, and this has consequences. For example, an elderly couple comes out of Kingston Hospital. As press report about this, that's a hospital in the suburbs of London, and they are visibly weakened. The man has been waiting for his prostate operation for a year, and the procedure has now been cancelled 3 times, as they say. Sometimes it's the strike, sometimes the material is missing or the staff is absent. His examinations would have to be repeated every time, but neither of them are angry about the strikes. The wife says the government is to blame for spending too little on the strained health system. Junior doctors make up around half of the entire medical workforce in the country, and these are doctors who are training to become specialists, and they demand significantly more wages. The work stoppage began last Wednesday and will continue until Tuesday if the doctors cannot reach an agreement with the Ministry of Health. And this would be the longest strike in the British healthcare system since the Second World War. And according to the Daily Telegraph, they reported this on Friday, the NHS is now starting to collect evidence of the harm to patients caused by the strikes. In London alone, 330,000 operations and examinations had to be cancelled because of the strikes, as the NHS announced. And since junior doctors in the UK began their protests and strikes in December 22, more than 1.2 million operations and medical appointments have had to be cancelled across the country. And the reason is the specialists who would otherwise operate have to step in for the striking doctors in the emergency room. So it is no wonder that the waiting list of patients waiting for treatment has risen to a record 7.7 million people, according to the British Medical Association BMA. And this is bad for Prime Minister Rishi Sunak, who actually wanted to reduce this waiting list by the election. The government therefore complains that the strikes are politically motivated. But the interns have lost patience now, and according to the BMA, their starting salary is £32,000 in the first year, and this is after 5 years of university study where tuition fees alone are £10,000 or more per year. The assistant doctors receive the equivalent of around €3,000 per month then. Here in Germany, they earn around €5,000 in the first year in the hospital, and they generally did not have to go into debt for their training. Start your day with news like this is not nice, but it is really an important issue, and that's why I'm talking about it again now. But after approval, 2 years of basic training follow here in Germany, and then 4 to 8 years of training to become a specialist. And salaries do increase over time. 3 to 8 years after the license to practice medicine, most female interns earn around £63,000. But the large number of hours spent in hospitals is backbreaking work. And the doctors are repeatedly deployed for significantly more than the agreed 40 hours. And many doctors complain that a private life is hardly possible. I can't even afford to go on strike, says a frustrated pediatrician at a London hospital who only completed his residency last year. And his wife is an assistant doctor who's training to be an anesthetist. I can't do without the salary that I lose every day of the strike, says the doctor. We have debts. We can't get by with low salaries. 3 children, high inflation, the expensive mortgage. We live hand to mouth every month, and that is a doctor. The young doctor who didn't want to give his name to the press is bitter, and he supports the strikes. After 10 years of training, they even can't afford a normal life. And this despite the fact that the parents helped with the costs of training and with the purchase of a house, and would have helped with the children and the childcare. He also doesn't like the media complaining that the strikes are harming the health system and the patients. He says the state spends less on healthcare than almost any other country in Europe. That's why we are lagging behind everywhere. In fighting cancer, in COVID, that's the problem, he says. And this resentment among the medical profession is widespread. I can actually only afford the job of assistant doctor because my wife also works and earns more than me. That was said by Dr. Zach Ferguson, for example, who reduced his job to 60% after his vacation so that childcare can be arranged at home. He says the job of a junior doctor is a luxury that not everyone can afford. And now he's on strike. The demand from the association that serves as a union, the BMA, initially sounds dramatic. It is calling for a salary to be increased by 35%, as I said. And the argument is, since 2008, that means over the past 15 years, the real wages of junior doctors have fallen by 26.3% because salaries were frozen for many years and only increased by 2% in 2022. This means that the real wages of junior doctors have fallen significantly more than those of specialists, which fell by 24.3%, and nurses by 8.4%, according to a calculation by the Financial Times. During the same period, real wages for the entire population fell by 3.5%. The Medical Association demands that salaries have to increase by these 35% to compensate for this real loss of wages. It's a simple percentage calculation. The BMA includes the increased housing costs in its calculations. The government does not do this. According to their calculations, the real wages of junior doctors have only fallen by 16%. They have offered a wage increase of 8.8% for this year and an additional increase of another 3%, which the doctors reject. And the dispute has been dragging on for months now. The specialist doctors and nurses have already ended their strikes with new pay results. Health Minister Victoria Atkins insists that the strikes must first be ended before renegotiation takes place. But the BMA does not address this. They want to hear a realistic proposal first. They signaled a small sign of peace, though. Restoring wage levels does not have to happen overnight, but can be stretched over a few years. However, the doctors are also concerned about the working conditions and the stress and the constantly changing location assignments. The issue is sensitive for the government and the NHS health system because other English-speaking countries just pay more. The USA offers the equivalent of just under £42,000 at a starting salary, Canada £46,000 and Australia £44,000. And that's similar to New Zealand. And Australia and New Zealand in particular are recruiting British female doctors with these higher salaries. Besides, the sun shines there, they promise in their poaching campaigns. 1 in 7 UK-trained doctors now practice overseas, and this means that the country is losing more medical staff than other European countries. When his wife finishes her training as an anesthetist, the London pediatrician wants to consider whether they should leave the country too. We have several doctors in our family. They are already asking why we haven't gone to Canada or Dubai yet, he says. However, they are attached to their family and to their parents, and that's what kept them, not the job. Last year, 11,000 doctors left the NHS out of a total of almost 377,000 doctors in the country. Great Britain is therefore hiring heavily, especially from abroad. According to the General Medical Council, overseas trained doctors made up 52% of the nearly 23,000 newly registered doctors last year alone, and another 10% came from the EU. The General Medical Council estimates that by 2030, around 39% of the entire British medical workforce will have been trained abroad. The number of people who have been employed in the system for less than a year has increased rapidly since the corona pandemic. But this leads to more stress in the system because routine is lost. New employees have to be trained, and the burden on experienced employees increases. As a result, even more doctors are leaving. But not everyone has that much understanding for the strikes. Doctors who defend their actions on social media are criticized by parts of the public as irresponsible, selfish, and arrogant. And the older man and his wife in front of Kingston Hospital are more lenient. They will continue to wait politely for his prostate operation, which should have happened quite a long time ago. And if you want to know more, the next video is right here on the end screen. I'll see you there. I'll be back.